So I wanted to find out the capacity that hospitals have to be able to respond to COVID-19. And so I convened a conference call of all the leading CEOs of all the hospital systems across the entire state of Texas, including those here in the Dallas-Fort Worth area. And we learned a lot of things, including the capacities that they currently have, whether it be with regard to beds, whether it be with regard to ventilators, whether it be with regard to staffing, which is very important because staff can contract COVID-19 also. And so we left there with some top line ideas that we're going to follow up on. The main thing I wanted to be able to address and have nailed down this week is the number of beds that will be available. We've seen in situations, whether it be in other states or other countries, about pressing needs for beds. First, I will tell you that I was impressed with the number of beds that already exist, as well as the additional secondary strategies that hospitals already had in place, including such things as medical tents that already exist. They can be propped up in a one-day time period, but it led us to certain additional strategies, such as acquiring additional medical tents to make sure that we will have full capacity. The second item that was mentioned that would be effective, because I was asking them for their input. They said that they could quickly upstand recently closed hospitals, medical centers, quick clinics, these standalone ERs, things like that are fully equipped to handle something like this. That could be turned around very quickly. In addition, there are other, if you would, pop-up temporary facilities that could be located at hospitals. And then I inquired about something that we already have in our inventory, and that is standalone empty motels or hotels. They are very useful for single-person bedrooms that have a bathroom in it for people who have tested positive with COVID-19 but are not in critical care condition. We need the hospitals to be available to take care of everybody who has a critical care need, but we also need other facilities available for people who tested positive for COVID-19 who need isolation. And so when you aggregate all of this together, we see and believe that we have plentiful supply of resources at different care needs that will be able to address what could be a significant increase in the number of people who are both testing positive for COVID-19, those who have minimal consequences of it, and those who have critical consequences from it.
Do you have a number?
We didn't come up with a raw number simply because there are easy example. We have a whole lot of hotel facilities offered to us, and we haven't added up all the bed numbers. I didn't do the multiplying factor of all these emergency medical tents that could be set up immediately, and we didn't do the math of adding it all up. But what the conclusion was, we have a plentiful supply to address the needs that we believe that we will be facing in Texas.